Hello, this is Nursing School. My name's is Patrick. Today, we are going to discuss about heart failure. Remember to subscribe, like and share, leave with comment. Heart failure. Heart failure, HF, sometimes referred to as congestive heart failure, is the inability of the heart to pump sufficient blood to meet the needs of the tissues for oxygen and nutrients. Heart failure is a progressive, lifelong condition that is managed with lifestyle changes and medications to prevent episodes of acute decompensated heart failure, which are characterized by an increase in symptoms, decreased CO, and low perfusion. Heart failure results from a variety of cardiovascular conditions, including chronic hypertension, coronary artery disease, and valvular disease. These conditions can result in systolic failure, diastolic failure, or both. There is two main classification of heart failure, which are left and right side heart failure. Left-sided heart failure, this is the most common type, and it occurs when the left side of the heart can't pump blood effectively to the rest of the body. This can cause fluid to build up in the lungs, leading to shortness of breath and other symptoms. Right-sided heart failure, this occurs when the right side of the heart can't pump blood effectively to the lungs. This can cause fluid to build up in the body, leading to swelling in the legs, ankles, and abdomen. Biventricular heart failure, this occurs when both sides of the heart are affected. Clinical manifestation of heart failure. Clinical manifestation of heart failure depend on the side of the heart that are affected. Left-sided heart failure most often precedes right-sided cardiac failure. Pulmonary congestion such as dyspnea, cough, pulmonary crackles, and low oxygen saturation levels. Dyspnea on exertion, orthopnea, paroxysmal nocturnal dyspnea. Cough initially dry and non-productive, may become moist over time. Large quantities of frothy sputum, which is sometimes pink. Bibasilar crackles advancing to crackles in all lung fields. Inadequate tissue perfusion. Oliguria and nocturia. With progression of heart failure, altered digestion, dizziness, lightheadedness, confusion, restlessness, and anxiety, pale or ashen and cool and clammy skin. Tachycardia, weak, thread pulse, fatigue. Right-sided HF, congestion of the viscera and peripheral tissues. Edema of the lower extremities, dependent edema, hepatomegaly, enlargement of the liver, ascites, accumulation of fluid in the peritoneal cavity, anorexia and nausea, and weakness and weight gain due to retention of fluid. Medical management. The overall goals of management of HF are to relieve patient symptoms, to improve functional status and quality of life, and to extend survival. Treatment options vary according to the severity of the patient's condition and may include oral and 4 medications, major lifestyle changes, supplemental oxygen, implantation of assistive devices, and surgical approaches, including cardiac transplantation. Nursing management of heart failure focuses on relieving symptoms, improving quality of life, and preventing complications. Assessment, monitor vital signs, regularly assess blood pressure, heart rate, respiratory rate, and oxygen saturation. Assess for signs of fluid overload, look for edema in the legs, ankles, and abdomen, as well as jugular venous distension. Assess for signs of impaired gas exchange, listen to lung sounds for crackles or wheezes, and monitor oxygen saturation. Assess for signs of decreased cardiac output, look for fatigue, weakness, and decreased activity tolerance. Assess for signs of anxiety and depression. These conditions can worsen heart failure symptoms and affect overall well-being. Interventions, relieving fluid overload, administer diuretics as prescribed, and monitor for electrolyte imbalances. Encourage fluid restriction as needed. Improving gas exchange, administer oxygen therapy as needed. Elevate the head of the bed to facilitate breathing. Reducing cardiac workload, administer medications as prescribed to reduce afterload and preload. Encourage rest and energy conservation. Promoting activity tolerance, encourage gradual increases in activity levels, such as walking or swimming. Managing anxiety and depression, provide emotional support and refer to mental health professionals as needed. Educating the patient and family, teach patients about their condition, medications, and self-care strategies. Encourage adherence to the treatment plan. Patient education, medication education, teach patients about their medications, including dosage, side effects, and importance of adherence. Dietary education, teach patients about a low-sodium diet and fluid restriction. Activity education, teach patients about the importance of regular exercise and energy conservation techniques. Weight monitoring, teach patients how to monitor their weight daily and report any significant changes. Symptom management, teach patients how to recognize and respond to worsening symptoms, such as shortness of breath and fatigue. Thank you for following nursing school. My name is Patrick. See you soon.